Moving on to the male anatomy now. Here's an MRI of the an axial T2 male anatomy. We have, I am now inferior. This is superior, so I'm going to start inferiorly. I think it's easier. First thing I want to point out, this is the ischium here. So ischium. And then right in the center, here's your corpus spongiosum, or the bulb of the penis, and the corpus cavernosum and the crus of the penis right here. So this is where it attaches at the ischium on both sides, and then eventually comes down and forms the body of the penis. Okay, so the bulb, the crus, corpus spongiosum, corpus cavernosum right here. All right, and then in here, if we go up a little bit, here's your coming down from the prostate into the penis. That's the penile urethra. Okay, right here in this area, we're seeing it right in a cross section as it heads down through the body. And then we have the coming up, we're going to start to look for the prostate, which is going to be in the center here. And this is prostate right here. Okay, rectum posterior, prostate. And then if we keep going up, here's your bladder. Okay, now this guy has an abnormality. This is a cyst of the ejaculatory duct. So that is obviously not normally supposed to be here. So now that we're in, this is prostate right here, this little hole in the cross section, which actually comes down from the bladder, is going to be your prostatic urethra, or the urethra of the prostate. Okay, because remember that the urine comes down from the bladder, travels through the prostate, inferior, 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 into the penis, and then out. Okay, so it has to travel through the prostate. So that's why older gentlemen who have prostatic hypertrophy, or they have swelling or issues in the prostate, it actually pinches off the prostatic urethra, which can cause hesitation and inability to urinate. So it's actually very common in older gentlemen. So here's prostate. I want to point out seminal vesicles, kind of look like little pebbles posterior to the prostate and bladder, right here. I want to point out anteriorly the spermatic cords. Okay, the spermatic cords where the vas deferens are going to travel from the pelvic cavity down into the scrotum. And now this doesn't go low enough, so I can't quite follow the vas deferens all the way down into the scrotum, but I'll show you on a next study. So the spermatic cords right here, and they're going to travel laterally, and then eventually they're going to take a turn, and you can see how it's just starting to take a turn here where the vas deferens would come down and empty into the ampulla of the vas deferens, and then eventually the seminal vesicles, right and left, right here. Okay, so that's the main male anatomy. Let's switch over to a sagittal view. So here's sagittal. Okay, we have, first thing you want to point out is the symphysis pubis. Okay, we have bladder here, and look at the different shape of the bladder compared to the female anatomy that we just went over before. So totally different shape. Here's our cyst, which we're not going to worry about that too much. The main thing we want to look at here is the prostate, which you can see right here. Here's your rectum coming down, prostate gland. Here's your prostatic urethra, okay? So you have connection from the bladder going to the prostate, prostatic urethra coming down into the penis, and then this little guy here is the penile urethra, which travels down, okay? Corpus spongiosum right here, the bulb of the penis, and then we have the two little sides, the corpus cavernosum on the side that makes up the body or the shaft of the penis there, okay? Rectum down to anus right there. Then you have your rectum. Here's rectum. We want to look at the different spaces in the male anatomy, which is a little bit different than in the female anatomy, remember, because the female has the uterus. The male obviously doesn't have a uterus, but there's still spaces here. We have the, let me switch over to the axial view. The first thing you want to look for is the prostate, and then the area behind the prostate and rectum is your rectovesical pouch, because your bladder is just superior to that, okay? So rectovesical pouch right back here. And then you have your retropubic space. Here's your pubic bone right here. So this space posterior to the pubic bone is your retropubic space, okay? And then in your sagittal, here's your pubis, retropubic right here, and there's your rectovesical right here. Okay, so those are your spaces in your male anatomy.